We've been guided by Western medicine, Western healing approaches, when we've always had our own healing approaches that our community members, our ancestors, and our elders have said that are just as relevant to us today.
And so we really need to start looking at how do we begin to look at what's called the social determinants of health and create wellness for our people in a way that's sustainable and comes from our culture and who we are.
The priorities that we're looking at with the Health Council is one is on mental health. Mental health wellness that we're saying is really so key and important.
In British Columbia, our First Nations leaders decided one way to support healing and wellness among our people was to take control of our own health services to reclaim our wellness.
The First Nations Health Council is appointed by chiefs and leaders across the province of British Columbia as an advocacy body to bring forward their concerns, their wants, and their needs when it comes to the health and wellness of their communities and their community members.
The Health Council has been developed in a way to take over and improve the health and well-being of our children and families in our communities.
The purpose of the First Nations Health Council is to advocate for the grassroots people, as well as First Nations Health Authority at a regional, provincial, and federal level. We're here to guide the transformation of health and wellness for First Nations in British Columbia.
And our job is to try to get what I always call boots on the ground, resources into the community. We create the space for the communities as they step in and do what they need to do to help their own people.
The purpose of the First Nations Health Council is mainly to ensure adherence to the tripartite accord that our leadership signed, along with the ministers and the Prime Minister and the provincial minister here in BC.
It's brand new to the country of Canada, where First Nations, we're taking over the health services of our people, rather than being governed from Ottawa. The distance is shorter, but more important is the programs that we are taking over to make sure that, we are in control of the health issues of our people.
Factors that contribute to our illness, so to speak, is really determined by the colonial processes and really driven, by what I call cultural or genocide, impacted by the residential schools, and how that tore apart our families and destroyed our governance of who we are as a people.
I was taken away as a child, and I remember that distinctly. And it was very traumatic for me. You can imagine how traumatic it was when they took my mother away. And I never saw her for 2 years. So that was hurtful.
Just like many other First Nations in this province, I've seen the devastating impacts of colonialism, residential schools, intergenerational trauma. So many people still dealing with things that have been passed on from generation to generation. And unfortunately, people tend to self-medicate to have that healing that they seek. And in the last number of years, we've laid to rest far too many of our members.
We've lost so many young people because of the opioid crisis. Not only young people, all ages, and if we don't do something, we're not going to have a younger generation leading us.
If you lose your culture and language, for example, through the residential school system, I think you lose your family values and structure.
At the heart of this transformation are the social determinants of health, the factors that influence health outcomes for First Nations people in BC. They are the conditions in which we are born, grow up, live our lives, and grow old, how we live a good life. They are the wider set of forces and systems that shape the conditions of our daily life, our individual health and wellness.
So our job is to not transmit intergenerational trauma, but to transmit intergenerational healing.
Well, I think the factors of health that determine how a First Nation in British Columbia does well or doesn't do well all comes down to, the key indicators of language and culture, food safety, housing, unemployment and income, clean drinking water. Without one or two of these, it really changes the longevity of their life.
So one of the things is that, partnering with other health organizations around the province to make sure that health services that we do need, is administered properly within the communities.
We need to make services more available in the communities. So whether it's nurse practitioners or doctors, you got to have access to this primary care. That's life-changing.
To bring back our culture into the health services is really key.
We need to understand that our way of life has been disrupted in the last 200 years. Our way of life before that was here for thousands of years. We still have that knowledge. We still have the ability to look after ourselves.
I also see going back to the gathering grounds to gather our traditional foods and our medicines and bring in cultural ceremonies back to assist with the impacts from trauma and grief.
I was fortunate to actually catch the tail end of total independence of our communities, where we looked after ourselves. And by that, I mean we were healthy. I saw my great-grandfather who was over 100 years old. I saw my great-grandmother who also was over 100 years old. That was due to good diet, no processed food.
If you lose your traditional foods, you end up replacing it with other foods, for example, inexpensive meats, or craft dinners, or fast foods, which all leads to health problems like diabetes, high blood pressure, obesity.
The governments of the day have taken it upon themselves to look after us, and it has not worked. It's time we took over control of our own lives again.
My dream is that First Nation leadership in the province stands up and says, health is our priority. And because it's our priority, I'm not going to miss any information session. I'm going to be there because we're in charge and we're governing.
I think my message to them would be, this is 10 years in, and we have our authority established. Now we're looking to make it fit our communities. And we all know that one size doesn't fit all. I know a lot of chiefs have talked about how can we transform the system that we have now, bring more resources into the regions closer to home, because we all know that what happens in downtown Vancouver really is a lot different than what happens in northern British Columbia or even in the interior of British Columbia.
I want to encourage our leadership to have a strong heart, strong mind. You know, we can work together and to ensure that our members' voices are heard.
My message to the Gathering Wisdom 12 is the upcoming 10-year plan. What do you want in your community? What is more important to the members in your community? It's important that we do the services that the community needs.
We need services closer to home, like primary care. Doctors brought closer to the community with our people. Services brought closer to home so our people don't have to travel.
Gathering Wisdom 12 is an opportunity to lay a different direction from where we're going. And so what's important is the chiefs and leadership, the council members, the health directors need to make a decision on where we're going to go and lay a foundation for change. And also our partners, provincial and federally, we have to ask them the same questions. What are they going to contribute to make a difference on the ground? It's because they have processes that they're in control of, they can actually change, and they can contribute to the solution, because part of the issue is they've been a problem for many years because of the systemic nature of racism, systemic nature of genocide. And so I think that they can come to the table as actual equal and full partners and create a solution with us.
But the most important part is us being in charge of our health.
We know how to look after ourselves. They've been disrupted so much. We need to find ways to bring that back. They're not lost, they're there. I keep saying it's for the children that we do this work, for the children. And I think that's what's important in the process.
Your attendance, your words, your support is so important. And I really look to see all of you at Gathering Wisdom.
I'm excited to welcome each and every one of you to Gathering Wisdom 12. And I hope that we can move forward united with a 10-year strategy when it comes to the health and wellness of all First Nations of British Columbia.